In Chapter 6 of Laura's story, Laura and I are joined by Dr. Hans Kreder. Dr. Kreder was the surgeon who took over Laura's care when she arrived at Toronto's Sunnybrook Hospital. Dr. Kreder describes treating Laura and the role that patients and professionals play in the recovery process.
We'll get straight into it if we could. Hans, you were the person who was presented with Laura, if I can put it that way, when you were in the hospital. And I wonder, what do you remember about the extent of her injuries, and what did you have to do in order to say, were they life-threatening? What did you have to do in order to save her life?
Yeah, right. So first of all, I'd rather be in Sicily where Laura is rather than on this virtual Zoom conference. That not being possible, we're here on Zoom. So it was, I believe it was 1995, and Laura, you can confirm that if it's correct.
Yeah.
But a colleague of mine who I'd gone to school with and gone through residency with, worked in Guelph at the time. His name's Ken McKenzie. And he initially treated Laura with serious injuries after she was hit by a drunk driver. And the injuries included what we call an open fracture. That is, the bone is exposed to the outside air on the left knee. And it was involving the knee joint, and also the bone above, the femur bone above the knee joint was broken. And it was the type of thing that is prone to infection, prone to the joint, if it's not reduced perfectly, becoming arthritic early on. And so it needed sort of the state-of-the-art expert care that we could provide. So I don't know exactly what Ken did initially, but I got Laura over here to Sunnybrook in transfer from Dr. McKenzie, and she'll know the details much better than I can recall them. But those were the injuries that we were dealing with. And in the initial reconstruction, we put the pieces back together, but we also needed to clean things out a couple of times to prevent infection from taking hold. And we used some, at the time, very new and modern techniques of doing that, including some antibiotic eluting bone substitutes to fill the gap and to sterilize the area. And so there were a number of hospitalizations, a number of surgeries, and it took quite some time before Laura came out the other end, was able to walk and able to mobilize, and we could sort of check off things,
Mm-hmm.
Joint stable, in good condition, check, arthritis not going to happen early, and the infection is under control, check. So those are the things that we worked on early on. But much more than that, Laura was a young girl, still is a young girl, but those are difficult times, and we also had to make sure that she kept her head on straight, because somebody with a serious injury at a vulnerable time in their life, and there's pain involved. It's very easy to spiral down that pathway of taking more pain medication to dull not just the physical pain, but the emotional pain of dealing with this life-altering injury. And that was also something that I was certainly worried about. And Laura's case, fortunately, didn't happen to spiral down that pathway. But those are the components of care. It's not just the bones. Those are sometimes the easy thing to put together. It's kind of watching and trying to do whatever we can from our limited capacity as healthcare providers to steer people in the right direction.
And it touches on the question I was initially going to ask Hans, but I think I'll ask both of you. Dr. Kreder, you see so many patients who suffer such trauma. And are you able to identify what traits a patient has that are going to make a difference in their recovery? Whether that recovery goes faster, whether that recovery is more comprehensive. Are there traits that are positives, and are there traits that, what is the role of the patient in their recovery?
It's a really good question and a really important one. And there is some research on this. So it's not just my own observations or experience, but one of the absolute key factors is a support group. Whether that's family, whether that's close friends, but the support group that exists before the accident or the injury, and if it's a close and solid group, that's one of the very key variables.
Mm-hmm.
And then, different people have different degrees of life experience. And some people, have a life where they've been in sports, they've had injuries during sports, they are comfortable with how their body reacts, they know what's normal, pain, if you will, they know, maybe something that isn't normal. But some people's life experience may be quite limited. And so it's the job of the healthcare professionals to guide them. This is normal pain. This is not something to worry about. And so it's partly life experience, and some people is very narrow. So anything that falls outside, both from the physical and the emotional aspect, is very stressful. And then it's up to us to, sort of work so that they can incorporate that new expanded range into their range of experience in a positive way. But the other thing, and people have called that different things, resilience or whatever, and some people, based on their experience, their life experience, have more of that than others. But I think everybody has a point where beyond which they are stressed, and the stress is something that we underestimate as a factor in terms of the recovery. It may be something that is perfectly normal or understandable to us as a healthcare team, but to the person, this is totally new and something they have no idea of. And the fear of what's going to happen, we often say, pain medication for physical pain, but often people, they're just afraid. They're afraid of what's going to happen to them. What does this mean? And so, some people, have difficulty sort of seeing a future with their altered self. And, just a little personal example, my youngest son, when he was 18 months, his finger got flattened, and he was trying to wrestle a stone eagle, and it fell on his finger, flattened it, and we as the parents, it was very difficult to think of, what if he was going to be a concert pianist? What if, so you immediately think about, how is this going to impact my future? How is it going to limit me? And it's our job as healthcare teams to say, okay, don't focus on your limitations, focus on what you can do. There are things that you can do despite, whatever alterations in your body. So to answer your question is difficult. The support team of family, friends, the support team of the healthcare, the supports that the healthcare team can provide, and then that intangible resilience, wherever that comes from, that some people just have a little bit more of through experiences, life experiences, or whatever, and it's our job to work with whatever people we find, whether they have that resilience or not. But those are some of the elements that, are important for sure.
So
Ortholink connects the work of the Canadian Orthopaedic Foundation to those we serve. To learn more about how your support is impacting lives, go to movepainfree.org. That's movepainfree.org.